Hello, everyone. My name is Kristen Krambeer, Advocacy Program Coordinator for the ARC of Iowa and its chapters. Thank you for joining us for Let's Chat, where I have short conversations with experts and professionals in their field on topics that matter to individuals with disabilities. I'm thrilled to be joined by a member of our ARC team today, Bailey Freese, Integrated Health Home Program Supervisor for the ARC of East Central Iowa. Bailey, thanks for joining me today.
Hi, thanks.
So before we get started, for those listening, reading, or watching, Integrated Health Home is also referred to as IHH, and you will hear both during our conversation today. So Bailey, let's just dive right in. What is Integrated Health Home?
It's a magnitude of things, but in a nutshell, it's helping those that live with mental illness of some kind manage their symptoms and be able to live fulfilling lives.
And what are the services that can be offered through IHH?
We can do things like supported employment, so helping gain and maintain employment opportunities in the community. We can help fund day habilitation programs that run during the day to help work on social skills and interacting with others, as well as in the community. We can do habilitation for adults, which is skill building work, so building those skills to be independent. If you're a child on the Children's Mental Health Waiver, you can access respite services, which provides caregivers with a break, as well as safe opportunities for those accessing it. And then there's just the case management piece where we help oversee and kind of orchestrate those pieces that are needed to access the services to be independent.
So for all of those services that are offered, are there certain requirements that someone would need to meet in order to be on IHH?
There are. So you need to have Medicaid, and part of the ARC is we can help you fill out those applications for things, as well as you need to have an updated diagnosed mental health condition within the last 365 days of enrolling for services with IHH. The downside is it does have to be from a mental health professional, so you are not able to go to like your primary care physician for that official diagnosis.
And so let's say someone comes to the ARC and says, hey, I don't have Medicaid, I need to get signed up for it. Do they still get the support in the interim or they have to wait till that's approved?
So we kind of guide you through it. But unfortunately, until you officially have that Medicaid piece, you don't have an IHH assistance, but we can help you apply for others as things. If it's for a kiddo, we could do the wraparound funding or seeds to kind of help do gap fills or region funding for adults.
Okay. And the IHH program, what are the current areas? So whether it just be the city of Cedar Rapids, or there counties that the service is offered in?
Oh, goodness, no. We cover the same 7 counties that the ARC of East Central Iowa covers. So places like Jones, Cedar, Benton, Lynn, and Johnson County.
And
I
then,
believe Iowa.
okay. And is IHH offered not through the ARC, but through other organizations statewide? So if I'm in Story County and I need those services, should I be able to get them?
Absolutely. They're offered in most of the counties that I'm aware of. One of the awesome benefits is if you see this and you don't know who your local agency is, we are able to pull up and search to help you find a local IHH provider.
And with the focus on mental health, because that's really what IHH focuses on, what do you see currently as the largest challenge in the state of Iowa?
Well, there's two things. On the mental health front, there is finding a mental health provider, whether it be those that can do medication management, counseling, or just general therapy with combination of the both. But mental health providers are very short at this point, causing very long wait lists, causing enrollment for IHHs to delay because we have to have that diagnosis.
And why are these IHH services so important, not just to the community or the region that we serve, but also statewide? Like, why are they valuable for people who may not understand some of the challenges that those needing IHH services have?
Living with mental health is different than those that live with like a physical disability or an intellectual disability because it's harder to point out in a crowd unless they're experiencing like a manic phase. it can be invisible and go undetected, and they can manage, but just because they're managing doesn't mean they're thriving. So these services help reduce those that end up in the jail population if they can get the right help, as well as keeping people out of hospitals and state institutions. Just because they have a mental health diagnosis doesn't mean they shouldn't have the opportunity to have a job in the community, have a family, live the fullest life to their best potential, graduate from college, do all the things that anybody that does not have a mental health diagnosis has the opportunity to do.
So let's say I am someone that I don't need IHH services, but I'm really interested in the field. Are there employment opportunities available? What does that
There
look like?
are. So I am a lucky lady. I have a fantastic team that is behind me, and we all work cohesively together. So any IHH is going to have a nurse. It's a requirement to have a nurse so that they can follow up if there is, for some other reason, a hospitalization or a medical concern. There are also peer support specialists, so people living with mental health diagnoses that want to help other people. So kind of that giving back state. But right now, the exciting part is we are expanding. And so we're looking for an IHH care coordinator at the moment.
Perfect. And how, if someone needs to get the IHH support, how would they go about starting that process with the Arc of East Central Iowa?
So if they're specifically looking for the Arc of East Central Iowa, they can call the main ARC line and ask to speak to myself or to Whitney Elber, who's the program director. And we can kind of take it from there and help you get things up and rolling.
And then if they were not with us, is it easiest to Google? Like you said previously,
Yeah.
they can reach out to you. You could kind of help lead them where they need to go.
Mm-hmm. So they can go to our website, which is arceci.org, and there's a link on there for Integrated Health Home that has all our contact information. If they call the main office line at 319-365-0487, they can talk to Shelby, who is our administrative assistant, and she can help navigate you to either Whitney or myself.
Perfect. Well, Bailey, thank you for talking with me today. For those
Absolutely.
interested in learning more about the ARC, again, you can go to the website, arceci.org for the Arc of East Central Iowa. I hope you all have the opportunity to reach your full potential today, and I look forward to our next chat.